As an advocacy organization, data helps us drive our advocacy effort.
Welcome to For the Health of It. I'm your host, Bill Evans. In this series, we're going to bring together scientists, luminaries, medical and public health experts to discuss some of the thorniest challenges in healthcare today. We're excited to have Anjee Davis, President, Fight CRC, with us to talk about the impact that COVID is having on the diagnosis and treatment of colorectal cancer. So I'm wondering if you could talk a little bit about how Fight CRC is using data to track procedures to improve long-term outcomes.
So in April, when we partnered with Komodo on looking at the impact of COVID, and we were able to be published in the New York Times, I think it really put a spotlight on what was happening in the colorectal cancer community, specifically the downgrade in colorectal cancer screenings. And I think that data is so incredibly important, especially for our community, to be able to sound the alarm. Looking back at what happened in April, looking at seeing the attention from the media that we received, it really helped us leverage opportunities to highlight just how important this is. As an advocacy organization, data helps us drive our advocacy effort. Fight Colorectal Cancer has been able to be a key partner with Komodo's help to provide those gaps in data. It's been a really, I think, fulfilling opportunity to be able to point to these realities and say, we can be here for patients. We can address this backlog. We can start pulling the data for our community that is overwhelmed right now and working on COVID.
So one of the things I think COVID has brought to the forefront is the issue of disparities of care. What are you seeing out there, and what is your community doing to address some of those challenges?
The highest death toll for a community is within the African American community. And so I've been really privileged to work with Black GIs around the country who are bringing this to the national forefront to say, hey, we've got to be aggressive about this. We've got to make sure we're messaging to patients to not delay their treatment, but also to know that they have options. For colorectal cancer specifically, you can get a colonoscopy, but there are also non-invasive screening tests available. For us, it's being relentless about your health care.
How do you think private organizations like yours can get either partner with or get more support from public organizations and government-led organizations to address some of these problems?
So Fight Colorectal Cancer has had a long relationship with the Moonshot program specifically. We were able to work with them during Vice President Biden at the time's effort to lead the war on cancer. So in light of that, I think we're looking forward to a very aggressive campaign with NCI support, DoD support, FDA support, and the CDC. Even now, we're working with the CDC to look at where COVID hotspots are and also where there are hotspots as it relates to colorectal cancer incidence rates. And we're having ongoing conversations with government agencies to say, what can nonprofit groups like ours do to empower patients, educate patients, support public campaigns around getting back to healthcare, and then also supporting educational efforts to provide the education and the free resources that patients need to feel supported.
So for folks watching this, what advice would you give them for how to get involved or what steps they can take to address the problem?
As it relates to healthcare and getting back to care with COVID, I really think from an advocacy, from a nonprofit perspective, it's really encouraging our patients to not delay treatment, not delay screening. I think there are going to be long-term effects of COVID for the cancer community that are going to be very serious. The director of NCI, Dr. Ned Sharpless, had pointed to the fact that, because of delays in care, because we're seeing a drop in diagnosis of cancer, we are going to see a higher death rate, a later stage diagnosis for many patients. So I think we have to brace ourselves, and we really have to make sure that whatever type of business you are, you could be a nonprofit, you could be a healthcare organization, that we're not losing sight of that. This is going to be a long-term problem, and it's going to require all of us to be working together and thinking innovatively and to continue to push ourselves to think about how can we address these long-term issues that COVID has presented.
Be sure to follow Komodo Health on LinkedIn or Twitter for updates on future episodes. See you next time.